All right, good evening, everyone. My name is Dr. Sandy Arthur, and welcome to our forum this evening, which is entitled Breastfeeding and Beyond. Step up for breastfeeding, educate and support. That's the theme for World Breastfeeding Week that we would have celebrated earlier this month. We welcome you to this program called Checking In on You, where the Southwest Regional Health Authority attempts to bring relevant, personal, relatable issues to you, raise awareness on them, and provide informative and evidence-based information on these topics. This evening, we'll be starting with a presentation by Miss Melissa Brayton, and it is entitled Access to Services within the Southwest Regional Health Authority. So I will turn over to her at this time as her presentation is loading so that she can give you this evening. Just remember to unmute if you're speaking, Melissa.
Right. Afternoon, everyone. My name is Melissa Brayton, and I will be presenting to the team this afternoon on how to access services within the Southwest Regional Health. And this afternoon session will be based on primary healthcare services. So, just a brief history or an overview of the SWRHA, and that is the Southwest Regional Health Authority, which is Swrha, is the biggest regional health authority within the RHAs within Trinidad and Tobago, which we serve a population of over 600,000 persons. Within the Swrha, we are comprised of 31 health care facilities, or as you may know, health centers, 2 extended care centers, 3 district health facilities, or DHFs, 2 hospitals, which is the San Fernando General and Teaching Hospital, which is 1, and then we have the New Point 14 Hospital, and 1 rehabilitative center. So what is the vision and the mission of the SWRHA? The Southwest Regional Health Authority vision is to become a leading provider of compassionate, cost-effective, premium quality care service to the people of the Southwest region. Our mission is in the business of promoting wellness and providing cost-effective, customer-focused healthcare to the people of the Southwest region within the guidelines of the national policy and ensuring our staff a productive and rewarding environment. So, we are presenting on primary healthcare. So what is primary healthcare? According to the WHO and UNICEF, primary healthcare is a whole of society approach to health that aims at ensuring the highest possible level of health and well-being and their equitable distribution by focusing on people's needs and as early as possible along the continuum from health promotion and disease prevention to treatment, rehabilitation, and palliative care, and as close as feasible to people's everyday environment. So what is a whole of society approach? It means that it's engaged with everybody within the primary healthcare setting. And as I go further, we would understand what the whole of society approach is in terms of having different services catering to the needs or the unique needs of individuals. So why is primary healthcare important to you, or why is going to a health center important to you? To help spot early health problems before they become serious. It is the best way to manage existing health conditions. It's early health intervention. Primary healthcare is the gatekeepers or the doorway to access non-emergent healthcare services and to provide services for each member of your family. So what are some of the services that primary healthcare offers that you can be become a part of after today's session. Our health office or walk-ins, and that service basically is if you have an if you have an early problem or early detection of a medical condition, you can come into any one of our health centers and on the health office days, and you will be able to access the services of the health center. We have chronic disease clinic, which is non-communicable diseases clinic. We have antenatal and postnatal clinic, which is something that we are actually going to be talking about because of breastfeeding and the importance of breastfeeding. We also have child health clinic, which is where you can get your kids immunized and follow-up care even after the baby has been born. There's follow-up care for your kids. There's family planning and pap smear services, contraceptive services for both male and females as well. We have same-day HIV testing, which are done at selected health centers. We have child wellness centers at some of our health centers. It's not at all, but at some. We have dressings, which is a service that we provide if you were to get any surgeries done within secondary care. You go to the health centers and they will teach you how to change your dressings and how to even do it for yourself application at home. We have adult immunization, and no, it is not just for COVID-19 vaccination, but we have different vaccinations for adults, and you need to check your immunization cards and make sure that your vaccination status is updated. We have pharmacy services, and that is done at all of our health centers. There are pharmacy services, and we only fill prescriptions that were issued under the SWRHA. Some of our specialist services within primary healthcare are the SPOG clinic or the specialist obstetrics clinic. For these services that are listed here, they are referral clinics, meaning that you must be referred from one specialty to this specialty, and they are also done at selected health centers. But these are services within the Southwest Regional Health Authority that you can investigate about, and you'll be able to get more information about it by visiting any one of the 31 health centers I would have mentioned before. Or as I go down, I would share with you our customer service contact number. But these are the services: specialist obstetrics clinic, mental health clinic, retinopathy screening, which is for diabetic patients who have problems or challenges with their eyes. You can get screening at any one of the health centers. Smoking cessation clinics. We have the change of catheter clinic, as well as the child development clinic, which are done, like I said, at specialist health centers. So when do you access these services? Routine visit once or twice a year for appropriate screening and general review. Any medical or health issue that does not require a visit to the emergency department. Now, you can also visit the Ministry of Health website, and you will get a comprehensive listing of what some of the primary healthcare services are and the emergency department services. However, I would share with you when you should visit the emergency department, whether you have severe chest pains, severe abdominal pain, if you would have been in a motor vehicular accident, if you would have experienced a gunshot wound or chop wounds, near drowning experiences, would have had a fall or a blow to the head, or if you would have ingested any sort of toxic substances, you should visit the emergency department. However, the list that I would have shared with you on how to access services and the services of the primary healthcare setting, there is an exhaustive list on the Ministry of Health website, so you could also visit and you will get more information as to when you should access the services. So how do I access primary services? You can walk into any one of our 31 health centers, from Caroni South all the way down to St. Patrick East and St. Patrick West. So what are the days and the operating times? Monday to Friday, 8 a.m. to 4 p.m. You can walk into any one of the health centers. So Should you require any further information concerning what was presented today or any one of our services, not just primary healthcare services, you can call our customer service call center, which is our quality customer service call center, which is 87-SWRA or 877-9742. The number is toll free, so you don't need to have money on your phone to actually call the number, because it's toll free. And should you want to be connected to any one of our health centers, they would actually patch you into one of the health centers. You just let them know the information that you require and they would transfer you to the appropriate services. If you have a complaint, a suggestion, or you want to give feedback, even after today's presentation, and you want to share positive feedback, you can go on our customer service email and share that, which is customer service, CUSTOMERSERVICE at swrha.co.tt, and share your feedback. Share all your positive feedback. We look forward to it because it really helps us to understand and to get a sense of what you learned or what we can do better, or the fact that you all were logged in. And you can visit any one of our Swrha social media pages, which is on Facebook and Instagram. And there you would get all the highlights on what is happening, what is next, what is upcoming. Even after today's presentation, you all will be given highlights on what has happened and what is about to happen. So like I said, just continue to share feedback at our customer service email, or you can even share the feedback by calling the 877-9742. So we thank you again for tuning in for this part of the presentation, and I will hand over to the panel for the rest of the presentation. Have a good afternoon.
Thank you very much, Ms. Breton, for that comprehensive overview of how to access services within the SWRAT. Before we continue, I would just like to remind you that this session is being recorded, and subsequent to this evening, it would be edited and made available on the Southwest Regional Health Authority's YouTube channel, so that if you missed it or you have a friend who would have liked to be a part of it and gain from it, they are free to do it at that point in time. You're also welcome to submit questions into the chat box as we go through the session. So we're going to get right into it, and I'm going to introduce our moderator, one of our panel members this evening. The moderator for this evening is Nurse Rachel Jardine Burkett. She is the Acting Nurse Manager for Community Health Services. She has practiced nursing for over 25 years and has worked in various capacities throughout the SWRAT. She has a love for people and a passion for maternity care. Her hobbies include gardening, cooking, and music. One of our panelists is Nurse Sally Chandler. She has been a registered nurse since 1993 and completed neonatal training in 2001. In 2010, she became a licensed midwife, and she has been a nursing supervisor in various departments since 2013. She is also a baby-friendly hospital initiative trainer. The vast experience and knowledge she has gained over the years make her more than qualified to sit on this panel today. I will now hand you over to Nurse Burkett so that she can continue to introduce you to our panelists and start our conversation this evening.
Good evening, Dr. Arthur. Good evening, everyone.
Hi.
The remainder of the panel include Nurse Yolande Davidson, who entered nursing over 36 years ago. She subsequently became a midwife and eventually trained as a district health visitor. Today, she is a part of the Lactation Unit of the Southwest Regional Health Authority, which promotes breastfeeding and provides mothers with support along their breastfeeding journey. Her hobbies include playing tennis, cycling, horticulture, and dancing, to name a few. Our next panel member is Nurse Delisha Abraham Benjamin. Nurse Benjamin has been in nursing for over 15 years. She has over 10 years experience as a midwife and completed training as a district health visitor within the last 5 years. She currently works in primary care. She is a wife and a mother who practices what she advises. She advises her clients to exclusively breastfeed. In her free time, she likes to sing. Our last panel member is Dr. Alet Khan. Dr. Khan received her MD in pediatrics 10 years ago and has over 18 years of experience working in the pediatric department of the Southwest Regional Health Authority. At present, she is a specialist medical officer and the acting head of department for the Neonatal Unit. She's a mommy to a 6-year-old boy and enjoys going to the beach. Thanks for joining the discussion today, ladies, and welcome. Let's get right into it. So my first question I would like to pose to Ms. Davidson. When should breastfeeding begin and why? Ms. Davidson? I'm not sure if she's having some technical difficulties, so I'll ask Ms. Chandler to respond to that question.
Well, good afternoon, everyone. So breastfeeding should begin as soon as possible after birth. So it is usually recommended within the first hour of baby's life. We should try to encourage the baby to breastfeed, as well as what we call skin-to-skin contact, which helps the baby to get accustomed to the mommy and helps with the various hormonal changes that helps to let down the mother's milk and so on. So I would have to say from within the first hour of baby's life, we would want to start breastfeeding and we would want to continue exclusively. So that means breast milk alone for the first 6 months of the baby's life. And thereafter, after 6 completed months, we continue breastfeeding along with complementary feeding and so on.
Based on your experiences and interactions with clients and patients, what is the reality of breastfeeding practices within the Swrha? Ms. Yolande, I'm seeing you, but I'm not hearing you.
I didn't know this question was directed to me. I thought you were still talking to Ms. Chandler.
No,
What's the question?
Based on your experiences and interaction with clients and patients, what is the reality of breastfeeding practices within the Swrha?
Well, based on my experience, from what I have observed, as the baby friendly coordinator for Southwest Regional Health Authority, I move around to the 34 health centers and also to the 2 major hospitals, Point 14 and at Antenatal Clinics. So we've been trained as trainers to train our staff how to teach women to how to teach women to breastfeed and how to support them with breastfeeding. And this is what has been going on. As a matter of fact, that's the mandate from the Ministry of Health. All the regional health authorities, the coordinators, we all meet. And we are actually having a breastfeeding camp, which is done on a regular basis. It's coordinated by the Ministry of Health, by the manager for national manager for breastfeeding, Mrs. Deborah Thomas. And so we're going to be on Friday to ensure that we are all on the same page and we are all saying the same thing, so that because our population moves around. So we want to be saying the same thing. Our training was in conjunction with Pan American Health Organization. And like Dr. Arthur mentioned earlier on at the beginning of the program, that is that our practice is evidence-based. And so we practice evidence. So everything that we do for our customers, for our patients, for our clients is evidence-based. It's international standards. So we ensure that Sally gave you you asked her about what is exclusive breastfeeding. So Sally gave you a comprehensive answer about what exclusive breastfeeding should be. It's all about, and that's what we practice at Southwest Regional Health Authority. Our breastfeeding rates. Why do we meet? Our breastfeeding rates are currently, according to the Ministry of Health, not where it should be, and according to the WHO, and because our training, like we said, is evidence-based, WHO recommends that we reach at least a 40% percentage of exclusive breastfeeding within this year, and by 2025, 50%, and by 2030, 70%. So we're currently working on that right now. That's our goal. All the regional health authorities are aiming to be accredited, our institutions to be accredited as baby friendly, meaning that most of our mothers who can breastfeed should be breastfeeding. Just a small percentage of women who may not be able to breastfeed. So that's what we're aiming for.
While you hold on to the mic, Ms. Davidson, could you share with us what services are available through Southwest Regional Health Authority to assist women on their breastfeeding journey?
Oh, sure. That's easy. Once women, once you're in the clinic, the antenatal clinic, or the maternal and child health clinics that are available at Southwest, and might I add, at all the regional, all the health centers, which are 34 in total. We also have 3 district health facilities, and of course, within those 3 district health facilities, Princeton, Superior, and Cooper, there are antenatal clinics. So we have about 34 antenatal clinics. And then at the 2 major our 2 hospitals, Point Fortin, we have a specialist clinic there as well, and also at San Fernando General and Child Health Clinic. So that from the time the woman joins the clinic, she's given information about breastfeeding. Actually, the ministry has devised 3 forms to ensure that this happens. So at the antenatal clinic, there are 3 forms: a Form A, a Form B, and a Form C. It's named accordingly. For the antenatal clinic, it's A. So there's a list of questions posed to the women through our district health visitors and our midwives who work at these clinics about breastfeeding. So the women are enlightened on their thoughts about breastfeeding. So they are asked whether they know X, Y, and Z. It's a list of questions that are asked, and if they of course, if they don't know, they're educated about it, about breastfeeding. When the woman comes to have the baby at hospital, there's another form. It's a Form B. So this form is filled out by the midwives who have done the delivery, and even if the woman had a cesarean section as well, and so that the woman is, if she was at the antenatal clinic, or when I mean as far as breastfeeding is concerned, she's given information when she comes to have the baby. And then this continues when she is discharged from the hospital. She goes back into the primary care setting to her health center, and the district health visitor follows up with to ensure that it's a continuum. It continues, breastfeeding continues. So we said earlier on that we encourage women, because our practice is evidence-based, to breastfeed for the first, that's like 180 days, and to continue to breastfeed the baby till 2 years and beyond. So we have people to support women in this regard. The ministry, and I like this forum because I don't know if it was intentionally for breastfeeding and beyond because of the book that the ministry printed, or if it was just a coincidence. So the ministry has printed a book in conjunction with the Pan American Health Organization to guide women along their breastfeeding journey. It's called Breastfeeding and Beyond. even if the woman didn't get a hard copy within the health centers, because they are available throughout Trinidad and Tobago, not just in the public setting, in the private setting as well. Even if you didn't get the hard copy, you can go onto the Ministry of Health website, um, um, function breastfeeding, and you will see breastfeeding and beyond. You can have the book, you can get the book downloaded, soft copy. All right. We usually give our numbers, phone contact. I move around as the coordinator for breastfeeding in Southwest. I move around to all the health centers and all Swrha institutions, and I provide my phone contact together with my colleagues. Swrha has trained um, in conjunction with the Ministry of Health. We have 9 breastfeeding trainers, and we are sensitizing, sensitizing our staff, and to further um, assist and support our clientele, our customers, our mothers, our fathers, our families about breastfeeding. So it's a continuum. So it starts antenatally, then when they come in to have the baby, um, even if they don't deliver at the public institutions, like I said, they have the information in the private sector as well, and it continues until the child is still breastfeeding, which is the recommendation is 2 years and beyond. So support is there. When the woman comes in to have her baby at San Fernando, like for example, I'm just giving an example at our two hospitals, San Fernando and Point Fortin. Let's say if the baby is placed next to the mother after delivery. Um, so we bring the room in so that the mother can see when the baby is ready to breastfeed. Breastfeeding is supposed to be responsive. Breastfeeding is supposed to be responsive, meaning that the mother should, the baby should lead, the baby should let the mother know when they're ready to feed. So this is called responsive or demand feeding. So the mother will feed the baby when the baby is hungry, and not we tell our mother to watch the clock, watch the baby, look at the baby, and that's how breastfeeding would go well. Of course, if the baby ends up in the neonatal unit by Dr. Khan or um, NICU, she is further given information and advice. She's advised to start to express breast milk, because once baby goes to the NICU or the nursery, means that baby is sick, and we want the best milk for the baby, which is human milk. We don't have human donor banks yet. It's coming soon. We've had workshops. The Ministry of Health is working on that. And but we encourage our women to express milk, express the milk. We have Swrha have purchased state-of-the-art pumps. They cost a lot of money. State-of-the-art, and so women helped by we have the nurses on the postnatal unit who help and advise mothers how to express their milk and to take to the nursery for their baby. So some women, the babies might have to stay longer than the mother in the nursery, in the hospital. The mother might have to be discharged, but she is encouraged and advised and shown how to express the milk, how to come to the neonatal unit to provide the milk for the baby. We have state-of-the-art pumps. Swrha has paid no expense in purchasing these, and these are all available for our clientele. You heard Ms. Brereton or Ms. Brereton, and I don't know if I'm pronouncing the word correct. She told you we service almost half of the country, over 600,000 people. So we cater for, well, not all of them would have babies in the NICU or in the nursery, but we do cater for you. We have the pump so that you can come and express your milk. We encourage you to continue the expression at home as well to maintain your supply. And later on, you will hear more from one of our members of staff who will be sharing her experience, and she will tell you how it's done, how she does it. She's currently breastfeeding, and so you can see how you are supported. All the district health visitors, all the nurses at all our institutions are aware of all this. They are aware about the books and how to help the mothers. If they have any concerns or challenges, they know how to reach us. We also have a lactation unit at Southwest Regional Health Authority. It's located on level 4 the teaching hospital in San Fernando. There you can go and get advice on breastfeeding. We have staff assigned to that unit. I also visit there as well. I was there today. Yeah, one of our staff is out on leave, on sick leave from COVID, and the other one is on vacation. So there's always somebody there. And before you leave, and I would like to give my phone number and my colleague's number. She's given me the authority to do that. And so my phone contact is 774-6617. You can message me. And my colleague's number is 712-9512 as well. And if you get your hands on a copy of the breastfeeding book, there are also contact information in that book, even if you can't remember what I just said, because I said a whole lot. So I don't know if I have to stop now.
Thank you for that wealth of information, Ms. Davidson. We know that sometimes we have unique situations that may affect mothers and breastfeeding. So I have a little example I want to share with you, and I would ask Dr. Khan to respond to this particular situation. If an infant is admitted to the neonatal intensive care unit, or there is a maternal condition that requires the use of medications that are contraindicated to breastfeeding, what advice should be given? So that is the first question. And why is this important?
Hi, good evening, everyone. Thank you for your question, Ms. Burkett. So there are some babies who unfortunately have to be admitted to the neonatal intensive care unit for short stay or long stay care and have to be separated from their mothers. So let's take, for example, mothers with hypertension. I mean, mothers have hypertension, they have diabetes, they could have thyroid problems in addition to multiple other medical conditions. There are very few medication that are absolute contraindications with breastfeeding, right? And these include amiodarone because it contains iodine and could affect the thyroid function. Absolutely contraindicated as well are those medication immunosuppressants for cancer therapy. Any gold salts, which we rarely have patients on those. Iodine, for similar reasons, because it could put the infant at risk for low thyroid function. Lithium, which I don't think we have a lot of patients on lithium, but it is an absolute contraindication, meaning there's absolutely no breastfeeding with this medication. And of course, your retinoids with your vitamin A, because these could cause severe anomalies in your baby. All the other medication, antihypertensive, anti-thyroid medication, your diabetes medication, even some of your medication for depression, they are transmitted in such a small amount in the breast milk that it is not harmful to the baby. So mothers can continue to breastfeed on their medication, and they don't need to stop. Sometimes their primary physician may be able to put them on a lower dose during the course of breastfeeding, just so that baby gets those essential nutrients from breast milk, from their mother's breast milk, that they can't get anywhere else. What could be advised as well, if they breastfeed first and then take the medication. That way the medication is at the lowest therapeutic dose in their bloodstream and therefore be even lower in their breast milk.
Thank you, Dr. Khan. Now I'm going to open the floor for some questions and answers. And I see in the chat, we have a question from Ms. Luke. Thank you for your question. The question is, what if you want to breastfeed, but you aren't producing milk? I would ask Ms. Chandler to answer this question for us.
So, very good question. Many times we have mothers saying that they believe they do not have enough milk. So actually, and many times we find when we do our assessment of the mother that it is sometimes is based on perception. That mothers perceive they don't have enough milk because they may, for example, squeeze the nipple and they find the milk is not spraying out. So if the mother has a perception that she does not have enough milk, I would advise that she could take advantage, come into any one of the health centers. She can come into our lactation clinic, as Ms. Davidson mentioned, so that she'll be properly assessed. So we can maybe help clear up that misperception as it is many times. But generally, what we would say is how breastfeeding works is the more you put the baby to the breast and the more you breastfeed, right? The more you increase the milk supply is increased. But that mother needs to be properly assessed. And what we say is you need to look at your baby and look for signs that the baby is receiving milk. And some of the main signs is that your baby is passing urine and stools. Because if the breastfeeding is not going well, that is if the baby is not latching on properly to the breast, and we say latching on to the breast. So the baby has to take a large mouthful of the breast, because if the baby only sucks on the nipple, the baby will not be getting enough milk. So we have to check to ensure that the mother is latched on, that the baby is latched on to the breast properly, and that will help to actually increase milk production. So the more baby sucks on the breast, the more the milk will flow and so on. But we just need to do an assessment and help and check. Right? So I hope that answers your question.
Thank you, Nurse Chandler. I see another question in the chat from Ms. Khan. What should you walk with to the hospital to help with breastfeeding? And she gave an example of whether she needs to walk with a breast pump or any other item. So I'll ask Ms. Davidson to respond to Ms. Khan.
So what do you need to walk with to breastfeed? Walk with yourself, with your two attractive containers, your breast. I love that question. I just had to say that. I'm sorry. So you just walk with yourself, because when you come to deliver, like Sally said, breast milk is present. I don't know. I think she said it during the pregnancy. The literature says that it's present from around the 14th week in your pregnancy. Actually, I had a lady last week at one of the health centers, and she said, "Nurse, I had no milk, and yeah, I usually have no milk at all." I said, "Okay, so we're gonna stay in touch." I said, "How many weeks?" You know, I asked her when is she supposed to have the baby and all of that. So she was less than 14 weeks, and the literature tells you that breast milk is usually present from around the 14th week. You start to see colostrum, the first milk. So I said, do you mind if we go and we go and take a look and what's going on, and show me, or she was telling me the reason why I asked her to see the breast is because she was saying that somebody told her that her breast was suitable for breastfeeding, healthcare providers. So I said, okay, let's go and see what's going on. So I took her to a nice quiet area in a nice room, and she and I said, "What do you think about show me how you normally do it." And she actually took out the breast, and she's saying she had inverted nipples, and the breast was quite normal to me. It wasn't inverted, not or anything. And I said, I have, so I usually walk I get my breast, show how I have to express it. I said, hey, let's do a little, we could do a little work, a little quick thing here, right, to show you how to hold the breast when you, because she's well endowed. So I gather that's why she called it a little challenge with breastfeeding. So I say, why don't you just look at me? Let's practice how you can hold the breast when you're going to breastfeed. And I had my breast because I have my mother breast, and I'm squeezing it. And I said, why don't you do it on your breast and see what's going on? And like I said, she wasn't 14 weeks yet. She was under 14 weeks. And she squeezed the breast, and she's not gonna squeeze it like how I usually squeeze the breast. And there was milk. And so she was like, "Oh my God, I didn't know I had milk. I didn't know." I said, "Yeah, so you have milk and it's not gonna disappear." So usually sometimes when you saw women like that, when women feel like Sally said, they perceive they don't have any milk, sometimes it's good to just do something like that, to show them, so that they would believe, to try to convince them that they have the milk and that milk is anywhere. So you have it from since the pregnancy. So by the time you're ready to have the baby, the milk is there. So all you have to do is just walk with yourself. You don't have to walk with anything. If the baby ends up in the like I said, we have pumps. We have people to show you how to express the milk, to take to the baby in the milk. You have to, even if you have your book for cesarean section, with whatever mode of delivery they're going to perform on you, whether you can have natural or vaginal delivery, you have your book for cesarean section, or you were having a normal, you were supposed to have a normal delivery and you end up having a cesarean section. I mean, breastfeeding, you don't have to work with anything. All you work with is your stuff for what you will need while you're in your confinement at the hospital, your nightie and the baby's clothes or whatever. Nothing else as far as breastfeeding is concerned. If the baby's sorry and ends up in the depending on how long the baby is going to be there for, you may have to invest in some breast milk storage bags. But when we reach that bridge, we will cross it. There's no shortage of breast milk storage bags in the country right now. So if it comes to that, then whatever. Then, but also now, you don't have to work with anything as far as breastfeeding is concerned.
Thank you, Nurse Davidson.
I don't know if any of my colleagues think I left out anything.
That was an excellent response. I'm going to take 2 more questions. So the first question is, do we have any plans for a milk bank in TNT? So I would ask Ms. Davidson to answer that one. And the next one, does a mother's diet affect breast milk? I'll ask Ms. Chandler to answer that one. So Ms. Davidson?
Good. Well, I'm so excited to talk about the breast milk storage bank thing. The human donor bank. People talk about the human donor bank. Our managers from Trinidad and Tobago, including our general manager, Mrs. Album, who's not here with us now. They all went to Brazil a couple of years ago to see how breast milk and human donor banks operate. Why Brazil? Because actually we have none in Trinidad at the moment. We recently had a workshop in October last year in conjunction with the Pan American Health Organization and our partners, our Brazilian partners, to see how we can set up a breast milk storage bank in the Caribbean. Trinidad is the chosen for the pilot project. Brazil, I said, because Brazil, would you believe, have over 225 breast milk storage banks. And of course, during the workshop, a presentation was done as to how they collect the milk and all of that. So that is in the horizon. So I'm hoping sooner, more than later, that you're going to see a milk bank in our country soon. And the midwife who's going to share her breastfeeding experience with us today, she was saying when she just had the last baby, she had so much milk. She said, Yolan, I don't know what to do. What am I going to do with all this milk? When is the bank coming? And we get this from women all the time. Yeah. And so pretty soon there is going to be, I hope, not just one breast milk storage bank in the region, and hopefully in Trinidad and Tobago. So when I go up to the one-day camp on Friday at Mount Hope Women's Hospital, of course I'm going to be pressing and to find out how far we have reached from the National Breastfeeding Manager, Mrs. Thomas, and to where we are at and when it's going to happen. Everybody is excited about this breast milk storage. It's going to be here soon. I know Dr. smiling. Everybody is excited. I am actually. I'm close over. I can't wait.
Okay, Yolan, thank you very much. I just want to step in here and answer my question, which has to do with, does a mother's diet affect breast milk? So I just want to answer that question by saying that all breastfeeding mothers, we usually recommend that they continue to eat just as they were when they were pregnant. So a mother needs to eat a well-balanced diet, and just simply we say, if you put food on your plate, try to, when a plate is full with food, different colors, you tend to take the science out of it. So even if you have rice, vegetables, peas, if you think about all the different colors, the more colors you have on your plate, you kind of almost sure that you're getting a well-balanced meal with all your vitamins and everything that is needed. And I also would like to add that actually research shows that a woman has to be very severely malnourished to not to be able to produce breast milk. So even if some people believe that, you know, they have to be eating all sorts of special foods and they have to eat meat and they have to eat large quantities, and that is not necessarily so. So that once a mother eats, as I said before, a well-balanced diet, she can produce the milk that is needed for her and the baby. Okay? And I think I went into the next question there that that spoke about people constantly say what not to eat because it gives the baby gripe and so on. So they may tell you, well, don't eat this food and don't eat that food. Now that's based personal for each mother, that may be different. You yourself, if you don't like certain foods and or you have realized throughout your pregnancy that something doesn't agree with you, well, I would advise you to stay away from it. But again, we stick to the foods that are eating your balanced diet, drinking your 6 to 8 glasses of water that is usually recommended anyway, and you can, it helps you to produce the milk that is required, right? So you don't have to worry about not eating the best, that is, you know, the meat and all the fancy foods. Once you eat your balanced diet and you can produce enough breast milk.
So we want to delve right into balancing work, family, and breastfeeding. Unlike 50 years ago, many breastfeeding women also work in full-time jobs, and this is often highlighted as a challenge for women as it relates to breastfeeding exclusively. I want us to have a discussion now pertaining to balancing our work life, our family life, and breastfeeding. So I'm going to ask Ms. Abraham Benjamin to come to the mic and share with us what inspired you to breastfeed exclusively. Is Ms. Benjamin on the call?
She is on the call, but she seems to be having some technical difficulties. Yes.
So let me ask then, until Ms. Delisha comes on the call, let me ask Ms. Davidson then, how can a woman manage to breastfeed and still go to work Monday to Friday, let's say 8 to 4 work shift? How can the woman achieve this?
Well, as Sally said earlier on, my colleague, she's a trainer like me, she's a trainer like me, that it can be done. It's very easy to do. I shouldn't, I don't know if I should say that. I mean, when I had 2 children, by the way, and I exclusively breastfed them, and I was working as well. I would go home lunchtime and breastfeed. My colleagues allow me to go home because I didn't live too far from the hospital. So I mean, we were nurses, so we worked all the shifts. So we worked nights, we worked evenings, we worked day. So once you start take your during the maternity period when you're home with the baby, after you've had the baby, the postpartum period after, and a couple months you're usually home. Most people are home until baby's about 3-4 months. Some people are lucky to get more time off. I was so happy for the pandemic because of that, because our mothers, are forced to come back out to work so quickly. And I had a couple of teachers who are my customers, my clients. And what I mean is not my personal clients, it's Southwest clients. They became my clients, and so they were able to stay home and breastfeed longer. And I was so thrilled at that. So once Sally said, you just have to eat a normal, well-balanced diet, and continue once you stimulate the breast, which is breastfeeding. When you're with the baby, you're going to produce a whole lot of milk, and so you'd be able to continue with breastfeeding, and breastfeeding would become successful. You can let me know when Delisha has come in.
I'm
I think
seeing
Delisha
that
is in now.
Delisha is
think
on
that-
the call,
Hi.
so I would ask her to share. Good evening, Ms.
Right.
Abraham Benjamin. Could
You
you
can
share with
continue.
us what inspired you to breastfeed exclusively?
Hi, everyone.
Yes, we are hearing you loud and clear.
Very nice. Hi, good evening, everyone. Sorry for that little technical difficulty. It's very nice to be on this forum. I'm very passionate about breastfeeding because I believe that breast milk is made for babies. Coming back to Mrs. Bouquet's question, I think the love for my children, and because oxytocin is a love hormone, and if you really, I mean, every mother more or less have a degree of love for their children, but when you want what is best for your child, you tend to, it pushes you to do everything within your power to allow this baby to have the best foundation for life, and the best foundation starts with breastfeeding. So I think it's my love and knowing what's best, having the information as well as a registered nurse and midwife, a district health visitor, how important breastfeeding is. It pushed me to do everything within my power to get this milk to my child. My breastfeeding journey has started with my first baby. I presently have 3 children, 2 boys and a girl, and all have been exclusively breastfed. So with the last child, which is the girl, I produced the most breast milk ever. For the first one, there was a bit of difficulty. So I understand mothers and what they go through. This baby is fussing, even as a nurse having the infant, you are wondering, is this baby getting sufficient milk? And it could be challenging at times, but you just need to stick with it and don't give up. Keep offering the baby the breast. And as you keep offering the baby the breast, it stimulates milk production. Oxytocin levels begin to rise, get that long. And before you know it, your few days of difficulties with breast milk, it just eradicates. So my and this best thing which inspired me to feed exclusively. So as a working woman, a mother, a wife, it will have its challenges. You just need to keep focused and be determined to never give up. Keep on offering the baby the breast. Go to breastfeeding lactation specialists, counselors, get the information. All mothers can breastfeed. It doesn't matter the size of the breast. Some people think, well, the bigger the breast, the more milk. That is absolutely not true, because I am petite and I have produced a significant amount of breast milk. So I just want to help some mothers who are working by, parents. Firstly,
you have to make up your mind that you want to breastfeed this child exclusively. So in that, as soon as the baby is born, they dry up the baby, skin to skin contact is necessary, right? So that skin to skin contact surges oxytocin level in your blood, and it helps with breastfeeding. Then after that, as soon as you can breastfeed baby in hospital, you have to try. Mothers need to ask. Close the door. No, I'm in a meeting right now. Close the door like that. All right. Yeah, so had a little bit of interruption. Sorry about that. So you try to breastfeed as soon as you can in hospital, and breastfeed on demand as you are in hospital for the first 24 hours. Keep on offering the baby on the breast, keep on offering the baby. Then you go home. When you go home, you just continue looking for the cues, looking for the baby will be rooting, make sure the baby is latched on properly, and that is not the nipple. That is the area needs to be covered, and the top part it will have a little bit exposed, and underneath the whole baby mouth will be over breast area, and they're gonna show you that he or she is full. He will detach from the breast and be relaxed. I think what happens is when mothers, when the babies are fussy, for whatever reason, they cool, they just want to suck, because a lot of babies want to suck. A lot of mothers could think that the baby not getting enough milk, but sometimes the baby just cool. Sometimes the baby just want to be in your presence. So you have to learn the baby. As you learn the baby, you're going to understand what the baby wants, and you just continue offering the baby breast as you can, and this will help with the breast milk production. And so that has been the home life. So what has helped me is that within the first 10 days, 3 days is colostrum, right? That use, then changes, right? When the milk, as you keep breastfeeding, you normally in the first few weeks, 1 to 3 weeks, you start producing more milk than what the baby needs. And this is to ensure your body is ensuring to protect the child and giving the child the antibodies and everything that breast milk have in it, the proteins, the vitamins, and the fats. After that, when you realize you are producing more milk than the baby needs, what you do is pump out the extra milk. And when you pump out the extra milk, because you have 2 breasts, right? So side, and then the other side with the both breasts because full. But what am I going with the other side of my breast? So I normally pump out the milk, mark the date and the time, and I store it straight in the deep freeze, because in the deep freeze it can last between 6 to 6 months to a year. And as I continue to do that, what happened? My breastfeeding level rises. Milk production, it keeps rising because I'm putting a demand on the breast. But for me, as a working mother, I am storing for my child, because I know that this milk it wouldn't waste, and the baby is going to use it eventually. So I continue to pump at home, having extra milk, and I store all the extra milk straight into the deep freeze, because it can last from 6 months to, I know you can put it in the fridge, and it can last approximately 7 days, right? But I prefer to put it straight in the deep freeze. That is for me. Then I continue doing this, and for the first 6 weeks, I continue to pump and store and pump and store and pump and store, and then I end up with a vast amount of milk, more than I need actually, right? But it will be used eventually. And after that, I make up my mind here what I'm going to pump on with, because I need to maintain the supply. Because if I stop breastfeeding within that 8 hours that I am on work, my milk supply is going to drop. And you must be pumping at least for the most extent every 4 hours. So what I normally do, I have a pump, I have a Maternal pump. It has a part that is connected to the to my vehicle. So it have a car charger. It also has a batteries that they could use. So like if you do not have an electrical outlet, I could pump there. It's available, and also have a next compartment that you could actually plug in the wall, right? So what I usually do, I walk with my pump on work. I have ice pack. If you once you have an ice pack available, the breast milk could stay 24 hours. So I have an ice pack, bottles that are sterilized at home, and also the connections to the breast area. So once 4 hours pass, or I'm coming close to 4 hours, and I have a break, right? I take that time and I take 15 minutes. And for my break, I take 15 minutes and I go and express my breast and come out. I find a cozy room, or I do it in my vehicle, and I just continue. And my milk production has remained relatively high. So this has helped me a lot. So I want mothers to know, working, yes, it could have some difficulties, but you can still maintain your milk supply working. And as soon as I come home, I take that milk and I store it directly to my deep freeze. I sterilize my equipment, and sometimes I store it in the fridge depending on the time, because it can take 24 hours once you finish sterilizing your equipment. And I pack it for another day and I continue my breastfeeding journey. So this is how I have been successful at breastfeeding my 3 children. And I intend to continue until my daughter, well, she weans herself naturally. So it can be done. You just need to be determined to breastfeed this baby exclusively and beyond. And I've seen a lot of benefits in my children. They are very healthy, and I thank God. I feel fulfilled and accomplished as a mother, that I did everything possible so that these babies could have the best foundation for life. And the best foundation for life, it starts with breastfeeding. I'm available to anyone who wants information on breastfeeding. I assisted a lot of people. I had one friend who, she went down to thinking the child was just bawling repeatedly, and she didn't know what to do. She said, I have no backup milk. What formula should I use? And I told her I don't want to use her name for for personal reasons. I said, here, what happened? You have sufficient milk and you can do it. I need to add something as came to my mind. At 4 months of age, a lot of women can think that the babies are weaning themselves. At 4 months of age, the baby have head control. They start to push up, and because of that, they are very easily distracted. I need to add this one, because at 4 months, a lot of mothers tend to wean their children, or say that the children doesn't want the breast. Here's what happened. Your child is very intelligent. They have head control. They are looking around, right, to see what is around them, the colors, the songs. What you need to do in that process, because right now, my same friend who was having difficulties but is exclusively breastfeeding her child, reach the 4-month mark, and the child keep on being distracted. And at that point in time, her breast climbed a bit. What you need to do is go in that room, away from people, away from songs, and breastfeed your child. This mark is a very critical mark. If you don't have the wisdom, you will believe that the child is weaning themselves, when it's actually the child being distracted with songs, distracted with people, learning, and so intelligent. So this is that we probably to focus on, because even as a district health visitor, I've noticed it taking statistics at the 4-month mark. A lot of mothers believe that the babies don't want the breast milk, or they're weaning themselves, or they're easily distracted. So all you need to do is adjust with the baby, and you can breastfeed up to 6 months exclusively and beyond. So I'm available. I love breastfeeding. Anyone who wants information, If they have any difficulties in the health center, I'm available. So this is my story. So I just want to encourage everyone that if I can do it, no matter the size, I am petite, right? You can do it. Every mother can breastfeed, but you have to be determined and willing to do it. So that's my story.
Thank you, Ms. Abraham Benjamin. I just have one more question for you. We heard a lot about how breastfeeding has benefited the baby, but I just want to find out from you, has breastfeeding benefited you as a mother?
Yes, greatly. Great. It has benefited me a lot as a mother. One, as the literature said, I have a strong bond with my children. You see, one interrupted me in my meeting. They tend to always want to be where I am. As it referred to losing pregnancy, I have lost all my pregnancy weight. My daughter is 10 months old, and I've lost all my pregnancy weight. I've saved a lot of money because I don't need to buy bottles. I've gotten a lot of sleep because I get some and prepare bottles for my child, right? So it has benefited me a lot. One of the great benefits for me is losing the pregnancy weight because I've gained 35 pounds. Had gained actually 35 pounds, and it's all gone. So mothers can really benefit from breastfeeding. You benefit financially, you benefit emotionally, and you benefit physically by losing the pre-pregnancy weight.
Okay, so thank you very much.
I love breastfeeding.
Thank you, thank you, thank you, Ms.
I will do it again.
Abraham Benjamin.
Any day. I have no.
Thank you, Ms. Benjamin.
You're welcome,
for sharing your journey with us. I just want to delve into two challenging topics for both healthcare workers and parents.
All right, thank you very much.
You're welcome, Ms. Abraham. The first topic is COVID-19 vaccines and breastfeeding. And I would like to ask Dr. Khan to address both COVID-19 vaccines and breastfeeding and mothers with a history of HIV. Dr. Khan, I think your mic is muted. So if you're hearing me, unmute your mic.
Yes, it was. So thanks. Good evening, everyone. With respect to the COVID-19 vaccines in breastfeeding, so all the COVID-19 vaccines are safe for breastfeeding mothers. According to the CDC, none of them contain live virus, so there's no chance of the mother contracting COVID or passing the virus through the breast milk to the breastfeeding baby. Yeah, it will confer the same immunity on mom, and the added advantage that whatever antibodies mom creates in response to the vaccine, some can be transmitted through the breast milk to baby, even though we don't have any studies as yet as to how effective it is in preventing COVID-19 in the baby. Some antibodies will cross through the breast milk and give some protection. Yeah, so none of the vaccines contain live virus, so they're all safe for breastfeeding mothers. With respect to HIV, once mothers are receiving their therapy, so their viral load is low, yeah, the risk of transmitting to the baby through breastfeeding is less than 1%, so it's about less than 0.3%. That is if mom has a low viral load. Now, in low resource settings, mothers are still encouraged to breastfeed even if they have HIV, because the risk of them using contaminated water, contaminated bottles, or not mixing the formula correctly, the risk to the baby is higher in terms of their health. So in low resource settings, they are still encouraged to breastfeed, right? In higher resource settings, so if you're given formula, there's zero risk of transmission of the virus, right? Because you're given formula. There are some studies that show that mixed feeding, so if the HIV positive mother gives breast milk and formula, that the risk is higher in transmitting the virus in mixed feeding. So therefore is recommended, if they are going to breastfeed anyway, that they do continue with the exclusive breastfeeding for the 6 months. Yeah.
Okay, thank you,
Was that
Dr.
clear?
Khan.
Or any
Yes.
questions with respect to that?
I'm checking in the chat. I'm not seeing any questions with respect to
I
both.
just wanted to add some points from my pediatric point of view to some of the questions, if that's okay.
That's fine, sure.
For the mom or who asked about if she's not getting enough milk, so you would know if your baby is having about 4 to 6 wet pampers in the 24 hours, then you're probably producing enough milk and your baby is getting enough milk. Yeah, so you're looking for at least 4 to 6 wet pampers in 24 hours to know that your baby is getting sufficient milk. You just make sure your water intake is good. Oats and almonds are supposed to be good to help increase your breast milk production.
Oh my God, really?
Well, you would have, I don't know if anybody heard about vervine and métis and fenugreek. So those are some herbal things that people use. It may work for some people. It may not work for everyone. And then if you do see a lactation specialist, sometimes they can put you on some medication to help increase your breast milk production. But the main thing is to just keep trying. The more the breasts are stimulated, it's going to tell your brain, I have a baby to feed, and it will have the letdown effect, and you will get milk. But you have to keep yourself hydrated. Try not to get too stressed out, because that stress hormone is going to reverse that milk letdown response. Yeah, so oats, almonds, lots of fluids. For the mom who asked about the gripe, yes, you do need a healthy diet, but some studies also show that sometimes the little flavonoids can pass through the breast milk. So like for those first 2 to 6 weeks, things that may make you gassy may make your little baby gassy. So it's not like, as I said, every mother is different, every baby is different. So you will gauge for yourself. I could say from experience, one time I had doubles. Well, that was the worst colic ever. So I had to, for my son. So I just avoided chana for like those first 6 weeks, and like broccoli would make me gassy. So broccoli and cabbage, I also avoided in those first 6 weeks. And it's just as their gut getting accustomed, and the flavonoids can cross into the breast milk, just like our medication could cross into the breast milk. The little flavonoids from the food can do it. So you just gauge and see how your baby responds. Every baby is different, and it's really just for those first 4 to 6 weeks when they are a little bit colicky and gripey that it causes most of the problems.
Thank you, Dr. Khan. We now would have another question and answer session, so persons can put their questions or concerns in the chat, and we will try to address them one by one. I also saw, while we're waiting for persons to put their questions in the chat, I also saw Ms. Davidson's hand was up. So I'm not sure if Ms. Davidson wanted to share some more information. So Ms. Davidson, if you would share now, and then I would start with the question and answers.
Yeah, hi. I just when you were asking about the benefits of breastfeeding for the mom, and you know, the great benefits of breastfeeding for the mother is it reduces the woman's risk of getting breast and ovarian cancer. I just thought I needed to say that. I didn't hear if anybody said that. And as far as benefits to the child is concerned, to the baby is concerned, to the child is concerned, it reduces the child's risk of getting lifestyle diseases. And one of the main ones I wanted to just touch on was diabetes, which is a scourge on our country. I mean, we have so many people with diabetes, and so that the longer the child breastfeeds, or like how to that exclusively breastfeed, to give the child more protection from developing breast diabetes later on. Of course, it reduces the child's risk of developing other chronic diseases as well, such as hypertension, etc. But I wanted to really touch on the diabetes because diabetes is a problem in our country. So I just thought I needed to say that.
Thank you, Ms. Davidson. Thank you very much for adding that to the conversation. I am seeing one question in the chat. It states, if you do unfortunately contract COVID-19 and have active symptoms, is there any risk to the baby from breastfeeding? Dr. Khan, would you like to address that question?
So it is not recommended to stop breastfeeding your baby if you have COVID-19. You just take the same precautions, wash your hands, wear your mask. Your baby can contract COVID-19 from you, but they can also get antibodies through your breast milk to help them fight off infection. So the likelihood is the baby may contract COVID, but it's really mild symptoms in these little babies, fortunately, and not severe. But you just take your same precautions. Wash your hands, wear your mask, and continue breastfeeding your baby. That is still the best nutrition to give your baby, even if you are infected.
Okay, another question. What can be used for sore or painful nipples? I would like to ask Ms. Chandler to respond to that question. Or for painful breastfeeding sessions, if I understand it correctly. What can be used for sore nipples or painful breastfeeding sessions?
So, okay, usually if the nipple is sore, well then that's a cue to us that perhaps the baby is not latching on properly to the breast, because the baby should not latch on to the nipple. Once breastfeeding is painful or the nipples are painful and so on, you need to look at how the baby is latching on to the breast. But actually, what is recommended for painful nipples is it is recommended that you actually express some of the breast milk. Let's tell you how wonderful breast milk is. So express some of the breast milk and use that, rub that on the nipples, and that has been shown to be quite effective actually in helping the nipples to heal faster. If you are having other issues with breastfeeding, meaning the painful breasts and stuff, sometimes depending on what it is, again, you may need to be assessed, come into the health center or the hospital and be assessed by medical or nursing personnel. Some simple things may be actually applying some warm compresses, taking a hot shower and letting the water hit the breast and so on, which will help to ease the discomfort and expressing the milk and so on, right? So, but yeah, that's what I have to say.
Oh, Okay, thanks, Ms. Chandler. Another question in the chat I'm seeing is it normal for a baby to have only one wet diaper in the first few days after birth while breastfeeding only? Dr. Khan?
Hi, so in the first 24 hours, sometimes it takes about a day for them to have enough urine. So we give them 24 hours to pass urine, but only one wet diaper after that probably means that baby is not getting enough milk. Yeah?
Okay, thank you. I am going to hand over to Dr. Arthur. If there are no further questions, Dr. Arthur, the mic is now yours.
Just one thing to add for that, Mom, what you could probably do is try to express and top up with your express breast milk. Yeah, if you don't think baby is getting enough and baby's not passing enough urine. So try to express some milk and after your baby goes on the breast, you could try to top up with the express breast milk.
Great. Thank you so much, Dr. Khan. And just to add on to that, if again, just as Nurse Chandler would have said, you're having any difficulties or any problems and you are concerned, visit one of your health facilities, go into one of your health centers, visit the lactation unit so you can get some advice, and both you and baby be assessed to ensure that both of you remain healthy and remain safe. So that brings us to the end of our discussion this afternoon on breastfeeding. We do hope that it was informative and helpful in some way to you. We welcome each and every question that was asked today, and they were all excellent questions. We thank each and every panelist and our moderator and our testimonials that would have been shared today, that would have been able to enlighten and make things more relatable to us as women, mothers, healthcare providers, and even if we had any gentlemen who joined in with us, how you can be supportive in this journey. Please note that we will have this session available on the Southwest Regional Health Authority's YouTube channel, so that if you think someone else would have benefited from it and they were unable to sign in or they forgot to log in tonight, they can be directed to those web pages. We encourage you to look out for further information regarding these checking in on you sessions that are held every fourth Tuesday of the month. We encourage you to come again, join in again, share the word, spread the word with someone. We already have 3 other sessions that are available already on YouTube. You can glance back at those. We would have done one for men's health, one for women's health. We looked at childhood, obesity and child wellness, and we also looked at sleep apnea already. So we thank you for joining us tonight. Keep safe. We don't have to tell you to drive home safely because you did it from the comfort of your home. Until next time. Bye.
Bye.
Bye, everyone.